Hello, this is my exposition for the book of English for Health and Science. These are the pages 44 and 45. Unit 4, Lesson 1. She can hardly speak. Robert is now working with Dr. Oliveira. Dr. Oliveira is interviewing a patient and her husband. Write her questions. Dr. Oliveira. Now, what is the problem, Mrs. Marshall? Mr. Marshall. Sorry, doctor, but she seems to be having problems talking. I can hardly understand her. Dr. Oliveira. When did she start having this problem? Mr. Marshall. About 2 hours back, I guess, around 9 o'clock. Dr. Oliveira. What happened exactly? Mr. Marshall. We were working out back and she said that her chest was starting to pain her again. Dr. Oliveira. Again? Has she experienced this in the past? Mr. Marshall. You bet she's had chest pains before. She was in the hospital 2 weeks ago over in California when we were seeing our son. Dr. Oliveira. What happened after she told you that she was in pain? Mr. Marshall. Well, she sat down and took a little rest. She said she was feeling better. Dr. Oliveira. Did you notice anything after that? Mr. Marshall. Well, then I noticed that she was speaking kind of funny and she couldn't walk real good. Her hand and arm were funny as well. Dr. Oliveira. In which side did this happen? Mr. Marshall. That would be her right side. Dr. Oliveira. Is she taking any meds? Mr. Marshall. Yes, she's taking some little white pills for her high blood pressure. Dr. Oliveira. Do you have them or happen to know the name of the pills? Mr. Marshall. Yes, I brought them with me. Here they are. Dr. Oliveira. Yes, you're right. They're metoprolol. It's a B blocker. Okay, it's time to have a look at your wife. B. Mr. Marshall uses some colloquial American expressions. Write their formal equivalents in the right-hand column. Number 1. I can't hardly. Formal English, I can't hardly. 2 hours back. 2 hours ago. I guess. I think. Or I suppose. Out back. Before. To pain. To hurt. You bet. You may be sure. Or certainly. Real good. Very good or very well. C. Fill in as many gaps as possible using the information from the consultation on the previous page. Last name, Marshall. First name, Linda. Age, 62 years old. Occupation, retired. Marital status, married. Shift complaint, chest pain starting 2 hours ago. Shortly after, she developed numbness and weakness on right side. Mild dysarthria. Blood pressure, 144/87. Heart rate, 89. Respiratory rate, 20. Temperature, 98.6. Past medical history. Patient treated for ischemic heart 2 out of 52 ago. Hypertension. Social history. No alcohol, quit smoking 16 years ago. Medication. She's taking some pills for her high blood pressure. E. Write 5 questions that you would ask the following patient's relatives. Case number 1. 80-year-old woman living alone found unconscious by visiting daughter. Number 1. Do you know if any of her close relatives presents any hereditary diseases? Number 2. Was she taking any medication? Number 3. Does she have any chronic diseases? Number 4. Did she tell you anything about how she was feeling days or hours before this happened? Number 5. What's her name? Case number 2. 8-month-old baby vomiting blood. Question number 1. Was it a few drops of vomit or was it more than a few drops? Question number 2. What was the color of the blood? Normal or dark brown? Question number 3. Has she or he presented any significant behavioral changes like excessive sleepiness or irritability? Question number 4. By any chance, did you collect a stool sample of the baby? Question number 5. What has the mother been feeding him? F. Roleplay taking a history of the two cases in exercise D. Dr. Oliveira. Good morning. Is that the stroke unit? Woman. That's right. What can we do for you? Dr. Oliveira. We have a patient who has just come in and we suspect that she has had a stroke. Can I speak to a doctor, please? Woman. Putting you through. Male. Good morning. Steve Harbinger speaking. Dr. Oliveira. Good morning, Dr. Harbinger. This is Luciana Oliveira from Primary Care. We have a patient over here that we think might have had a stroke. Dr. Harbinger. Okay, can you run through the case? Dr. Oliveira. Sure. The patient's name is Linda Marshall. She is a 62-year-old retired factory worker who lives with her husband, and she has had a history of ischemic heart disease, although we are still trying to get the details. Her husband reports that she complained about chest pain this morning, and then shortly after, she developed right side hemiparesis with mild dysarthria. Dr. Harbinger. Okay, let me get that right. Chest pains and then right-sided weakness with speech difficulty? Dr. Oliveira. That's right. Vital signs okay. Blood pressure 144/87, pulse 89, respiratory rate 20, and temperature of 98.6. Dr. Harbinger. When did she have the attack? Dr. Oliveira. At about 9 this morning. Dr. Harbinger. About 2 hours ago. Okay, sounds like a possible candidate for thrombolytics. Send her for a CT scan, do a 12-lead ECG, we need international normalized ratio, and activated partial thromboplastic time. And find out what you can about the heart disease. I'm on my way. Dr. Oliveira. Wow! Super doc or what?